Hi guys, Dr. Kid here. In this video, I'm going to go through a comprehensive guide on what you need to know to treat your gout effectively. This video is going to cover what gout is, what are the complications of gout, how to manage an acute flare-up of gout, and how to effectively manage gout in the long term. So the first question is, what is gout? Gout is a condition where there is an elevated level of uric acid in the body, and this leads to deposition of urate crystals in different areas of the body, such as the joints, the soft tissues, and the kidneys. This is what leads to the complications of the disease. When urate crystals deposit in our joints, it causes pain, swelling, and inflammation. And this is what most people know as gout. The most commonly affected joint is the first metatarsal phalangeal joint, which is the joint around our big toe. However, gout can affect any joint, that is just the most common joint that is affected. Urate crystals can also deposit in our soft tissues, and this leads to firm, hard lumps called tophi. Tophi only tend to occur in patients that have had long-standing uncontrolled gout. The final place urate crystals tend to deposit is inside our kidneys. This leads to kidney stones, kidney inflammation, and ultimately kidney damage. So the first aspect in the treatment of gout is the treatment of an acute flare-up. Now, acute flare-ups are very painful, and the best treatment in these acute phases is actually to use medicine. Now, I have 3 medicines that I use typically to settle an acute flare of gout very quickly. As usual, it's really important to speak to your doctor to see which one is best for your specific case, depending on what medicines you're already taking or what other medical conditions that you have. The first medicine that I use in my arsenal against acute gout is colchicine. The typical dose I usually use for colchicine is usually 1 gram straight away and then 500 micrograms 1 hour later. For some patients, this can be really effective and a very quick way to settle down their gout. The second type of medicine I use against acute gout is usually non-steroidal anti-inflammatories. Some examples that I can use include ibuprofen, diclofenac, indomethacin, celecoxib, and meloxicam. Usually to get good results, I usually use the higher end of the doses of these medicines for 3 to 5 days. The third medicine I often use to treat acute gout effectively is prednisolone. Prednisolone is a corticosteroid and it's a very powerful anti-inflammatory, and I find in general it probably is the strongest out of the 3. A typical dose I would use of prednisolone is 25 to 50 milligrams once daily for 3 to 5 days to effectively control the gout. Just to remind you again, these are just guidelines. It really depends on your medical conditions and what medications you're already taking as to what I often choose to treat your gout effectively. The next aspect of treating gout is treating gout in the long term. Now, why would we want to control gout in the long term? Well, the first reason is to prevent acute flares. Acute flares are very painful. Most people don't like pain, so we want to try and prevent that. The second reason is we want to prevent long-term complications of gout. So if you get a lot of acute gout flares in your joints, you can actually cause a lot of permanent joint damage, leading to osteoarthritis, and this can lead to ongoing pain even when you're not having a flare-up of gout. We also want to prevent the other complications that we've already touched on, including deposition of tophi in our soft tissues, and also kidney stones and kidney damage from high levels of uric acid over a long period of time. I want to split the long-term management of gout into 2 aspects. The first is lifestyle or natural ways that you can reduce your uric acid and reduce your gout. The second is pharmacological or medicines that can be useful to prevent gout in the long term. Let's start with lifestyle. The first most important thing when it comes to lifestyle is reduction of alcohol. Alcohol is the most common reason in my clinical practice that I see a flare-up of gout, and it increases uric acid and is the most important thing to avoid when it comes to gout. The second most important dietary change is to avoid foods with high purine content. This is usually seafoods or red meats. Purines get converted to uric acid in the body, and then this leads to the complications of gout. The third most important thing to avoid is fructose sweetened drinks. The best example of this is soft drinks. Cutting out soft drinks in your diet is a key way to lowering your uric acid and curing your gout in the long term. Another critical lifestyle measure to manage gout effectively is to ensure adequate hydration. When we are dehydrated, this increases the concentration of uric acid in our blood and increases the risk of flare-ups of gout. The final really important lifestyle measure to help with gout in the long term is weight loss. Many of my patients with gout that lose a lot of weight usually significantly improve their gout, and weight loss is recommended by a lot of guidelines to assist with the management of gout in the long term. So to summarize, the 5 key lifestyle things you need to do is 1. Avoid alcohol. 2, avoid high purine foods such as seafood and red meat. 3, avoid fructose sweetened drinks, soft drinks being the best example. 4, make sure you get adequate hydration. And 5, weight loss. For most patients, if they implement all these lifestyle changes, they can essentially cure their gout and no further medicine is needed. However, there will be a group of patients that either cannot completely stick to the lifestyle changes and still want something further to try and prevent gout flares. Or there are some patients that do adhere strictly to the lifestyle changes, but because of genetic predisposition, they just cannot get their gout under control. So for these patients, we can use medicine to help us manage their gout effectively. The most commonly used medicine to lower uric acid in the long term and help prevent complications of gout is allopurinol. The way I use allopurinol is I usually firstly measure the patient's uric acid levels in the blood, and the targets that I aim for with allopurinol therapy is to keep the uric acid under 0.36 for patients that don't have any tophi, or under 0.30 if the patient does have tophi. So what I typically do is I start with 100 milligrams, and then I recheck the uric acid after 1 month, and then I slowly increase the allopurinol by 100 milligrams every month until I reach the targets of less than 0.36 for no tophi or 0.30 for tophi. There are times I may deviate from these guidelines. For example, in an older patient or someone that has mild kidney impairment, I may only start on 50 milligrams. Another example is that I might start a patient on 100 milligrams of allopurinol, keep them on it for a month, recheck the uric acid, and it comes back at 0.37. The patient had absolutely no symptoms and they're quite worried about increasing the dose because of side effects. In that instance, I would definitely just keep them on 100 milligrams because it controls their symptoms and the risk is low of long-term complications. I'll share these examples so that you can see that medicine sometimes can be an art, and it's really important that you discuss your treatment options with your specific case with your doctor. So that was my concise guide on gout. If you found it was really helpful, make sure that you like and subscribe to my channel, and I'll see you in the next video.